Hi friends, good evening. We'll see important points. Today's topic is on fluid and electrolytes. Mainly electrolytes we are seeing. First one, sodium. Normal serum sodium level is 135 to 145 milliequivalent per liter. That is the normal serum sodium level, and in the serum sodium level is less than 135 milliequivalent per liter is called hyponatremia. If the person is getting hyponatremia, we can administer IV solution of sodium chloride. Infusion we can do to restore the sodium content and fluid volume, and also we can tell the patient to take sodium intake, that is through salt or sodium rich diet we can advise. And hypernatremia means serum sodium level that exceeds 145 milliequivalent per liter, that is hypernatremia. If the person is having hypernatremia, what we can do is administer diuretic that promotes sodium loss. Through diuretics sodium loss will occur, and also we can do restrict to patient, that is restrict sodium and fluid intake as per the doctor's order. And we can see the common food sources of sodium include butter, canned food, cheese, milk, table salt, whitened whole wheat bread, ketchup. These are all some important common sources of sodium. And another one important point, hyponatremia precipitate lithium toxicity in a client taking lithium. That is, if the patient is taking lithium and having hyponatremia, that precipitate lithium toxicity. Why? Means that is, hyponatremia causes diminished lithium excretion. So decreased lithium excretion cause lithium toxicity for a patient taking lithium. And next electrolyte is potassium. Normal serum potassium level is 3.5 to 5.1 milliequivalent per liter. That is the normal serum potassium level. And if the serum potassium level is less than 3.5 milliequivalent per liter is called hypokalemia. Cardiovascular changes in hypokalemia include thready, weak, irregular pulse. That is weak, irregular, thready pulse in case of hypokalemia, and weak peripheral pulse. Peripheral pulse also weak, and orthostatic hypotension. Orthostatic hypotension means if the person is sitting also there is a decrease in BP. And next is hyperkalemia. Hyperkalemia means serum potassium level exceeds 5.1 milliequivalent per liter. That is hyperkalemia. And the cardiovascular changes in hyperkalemia include slow, weak, irregular heart rate. The heart rate will be slow, weak and irregular. And decreased blood pressure also we can see in case of hyperkalemia. And the common sources of food of potassium include avocado, banana, carrot, fish, mushrooms, orange, potatoes, pork, beef, spinach, strawberries and tomatoes. These are all some common food sources of potassium. And if the person is having hypokalemia, we should advise the patient to take these food items. Monitor the client closely for signs of potassium imbalance. Potassium imbalance can cause cardiac dysarrhythmia. So, what we should do is, if the person is having either hypokalemia or hyperkalemia, we should continuously monitor the patient. Why? Means there is a chance of cardiac dysarrhythmia. And the next point, potassium is never administered by IV push, intramuscular or subcutaneous route. Potassium we are not giving directly IV push or intramuscular or subcutaneous route. How we are giving potassium is, IV potassium is always diluted and administered using infusion device. So how we are giving is through infusion pump. We should dilute and administer through infusion pump, or we should dilute in RL, Ringer lactate solution, or sodium chloride solution. We should dilate in sodium chloride solution. We should dilate and we should administer to the patient. Precautions with intravenous administration of potassium. So what are the precautions as a nurse we should take before administering potassium to the patient? As we already saw, potassium is never administered by IV push, intramuscular or subcutaneous route. We are not administering directly to the patient by IV push or intramuscular or subcutaneous route. We should dilute and we should administer to the patient. A dilution of no more than 1 milliequivalent of 10 ml of solution is recommended. So, in 10 ml, 1 milliequivalent of potassium is diluted and we will administer to the patient. And next point, after adding potassium to an IV solution, rotate and invert the bag. So, after adding potassium to IV solution, that is RL or NS solution, we should mix the potassium in that bottle. So, potassium is distributed evenly throughout the IV solution. Why we are mixing is it will be evenly distributed the solution. And maximum recommended infusion is 5 to 10 milliequivalent per hour. So, 5 to 10 milliequivalent per hour we can administer. Never exceed 20 milliequivalent per hour. If a client receiving more than 10 milliequivalent per hour, should be placed a cardiac monitor. Why means it may affect the cardiovascular system. So we should monitor the patient and monitor the serum potassium level closely when a client is receiving potassium sparing diuretics. Examples for potassium, one of the example is spironolactone. If the person is getting potassium sparing diuretic, we should monitor serum potassium level closely. Potassium infusion can cause phlebitis. Phlebitis means inflammation of the vein. So, potassium infusion can cause the phlebitis. So, while administering potassium, we should assess IV site frequently for phlebitis. If so, if phlebitis like edema, swelling, any redness is there, we should immediately stop the administration. And as a nurse, we should monitor renal function tests before administering potassium. So, before administering potassium, we should monitor RFT, that is blood urea, creatinine and Bund ratio. We should check and we should administer potassium and monitor intake and output during administration. Continuously, we should monitor intake and output for the patient. And another one important topic, edema. Edema is accumulation of fluid in the interstitial space is called edema. That is between the tissues there is an accumulation of fluid. That is localized and generalized edema. Localized edema means edema occurs as a result of traumatic injury. Any injury, causes of any injury, that is localized edema occurs, like accident, burns and surgery may cause localized edema. And generalized edema means it occurs, that is excessive accumulation of fluid throughout the body is called generalized edema, is also known as anasaka, is generalized edema. And we will see fluid intake and output. Fluid intake per day we can see ingested food through ingested water. Through water we are getting 1200 to 1500 ml and ingested food by food 800 to 1100 ml and metabolic oxidation in the body, that is 300 ml. Total 2300 to 2900 ml. And fluid output per day we can see kidney, through kidney, that is urine 1500 ml, insensible loss through skin, through sweat and all it is 600 to 800 ml, insensible loss through lungs, that is 400 to 600 ml, that is inspiration and expiration, gastrointestinal tract, that is 100 ml, through feces it is 100 ml, total 2100 to 600 to 3000 ml per day fluid output.